Hello, dear friends. This is Sofya Dorinskaya with you. I am a psychiatrist and the head of the Sofya Dorinskaya Center for Medical Information. Today I want to discuss with you a problem that people face, which we encounter when we provide people with tests for eliminating nutrient deficiencies. This is the problem when people take medications for a long time that block the secretory function of the stomach. Let me briefly explain to you how digestion works in our body. Digestion begins in the oral cavity. Food should be thoroughly chewed. The food bolus should be well moistened with saliva. Next, it enters the stomach. There, under the influence of the acidic environment, it undergoes its own transformation. When it enters the duodenum, the acidic environment changes to an alkaline one, and there, its own stages of digestion take place. Bile is secreted there, and pancreatic juice is also released there. Next, from the duodenum, the food bolus moves through the small intestine, then through the large intestine, and is ultimately excreted through the rectum. So each stage of the food bolus passing through the gastrointestinal tract is very important. If a person has no teeth, is missing teeth, and the food bolus is poorly digested, or if the person is taking certain medications that block the secretion of sufficient saliva, then already at this stage, the person is predisposed to various future problems with the gastrointestinal tract, gastrointestinal diseases, and so on. The next stage, well, we will discuss it today, right? This is when a person takes medications that block the secretory function of the stomach, that block the secretion of hydrochloric acid, or even gastric juice in general, which also contains some other components. What consequences can there be if a person for a long time and without control, simply because they have painful symptoms, takes medications that block the secretory function of the stomach? First of all, this person, so to speak, is heading straight, absolutely directly towards scurvy, because vitamin C is extremely unstable in a neutral or alkaline environment. In order for vitamin C to be absorbed, the body needs an acidic environment in the stomach. And if a person takes medications for a long time that essentially destroy this acidic environment in the stomach, they will definitely develop scurvy. I want to strongly remind you that scurvy is a potentially deadly deficiency disease. And as a direct result of this severe vitamin C deficiency, there can often be extremely serious secondary diseases that develop, such as various chronic inflammatory conditions that affect the entire body. And for example, such a severe disease as tuberculosis. Moreover, if tuberculosis is secondary to vitamin C deficiency, then treating tuberculosis will not be effective until the person's vitamin C deficiency is addressed or scurvy is treated. This is the first problem, or rather, one of the problems that a person will encounter if they continuously suppress their stomach's excretory function with medication. I have already told you that the food bolus moves through the gastrointestinal tract, and at each stage it must be properly processed. If the food bolus in the stomach is not processed under the influence of gastric juice, then the absorption of nutrients will be impaired, and as a result, absolutely any deficiency-related diseases can develop. This includes vitamin A deficiency, B group vitamin deficiencies, pellagra, riboflavinosis, and anything else you can imagine. That is, any and all deficiency-related diseases, whether known or unknown, will affect a person. Most of these are fatal, the ones that have been identified, right? Beriberi is a vitamin B1 deficiency, and it is a fatal disease. A deficiency of pantothenic acid or vitamin B5 is also a fatal disease. Scurvy is fatal, and so on and so forth. So these are all life-threatening conditions. A person, in fact, brings about their own end. The next problem is various intestinal diseases, because consuming unprepared food masses leads to inflammatory processes in the gastrointestinal tract. Well, from there, it all depends on how much strength the body has. Either it stops at inflammatory diseases, or it develops into some kind of cancerous conditions, whether benign or malignant. That is, If we also take into account the background of deficiencies like hypovitaminosis, then in general it's impossible to predict how things will develop or which direction it will take. Everything depends on the strength of the body itself. Another problem that a person might face is anemia. The scientist Castle discovered, he has this theory, he found that for a person to have normal blood formation, there must be two factors. He called them the external and internal factors. The external factor is found in foods such as liver, meat, eggs, rice bran, generally in the outer layers of grain, wheat germ, yeast, and so on. But the internal factor is found in the gastric juice, which is secreted by a specific part of the stomach. And it is absolutely clear, as has been observed, that if a person, for example, has had their stomach removed, they may develop what is called macrocytic anemia. This is an anemia in which the number of red blood cells decreases, the size of the red blood cells increases, their shapes become varied, the amount of hemoglobin decreases, and all of this indicates a disruption in the process of blood formation. So, the root cause of this anemia, the root cause of this disruption in the process of blood formation can be, well, the absence of these external or internal factors. It should be noted that in some people, if they have undergone a gastrectomy, the internal factor remains because the lining, well, the inner membrane of the duodenum in some people can sometimes produce a similar substance which is found in one of the parts of the stomach, the so-called pyloric part of the stomach. But this, as they say, depends on your luck. Not to mention the fact that all those problems, such as vitamin C deficiency, the intake of improperly processed food boluses, and all the subsequent issues will still lead a person to a very serious condition. We had a real case where a person was taking these drugs that block the stomach's secretory function for 3 years. And the doctor was not monitoring this. Why am I making this video? My friends, you must not take any pills without supervision. Someone asked me in the comments, then why are these pills sold so freely in pharmacies? The law on selling pills in pharmacies does not regulate whether you can take these drugs as much as you want or not. This law regulates the distribution of narcotic substances and some other substances, but it does not control the distribution of medicinal or non-medicinal drugs. Yes, all of this is connected with, well, it's basically about production, right? And pharmacies, it's a certain kind of business. That is what permits a pharmacy must obtain, and so on. So, which drugs are sold by prescription and which are sold over the counter is absolutely not a criterion for whether you can take these drugs as much as you want without a doctor's supervision or not. So if you are taking medications that block the stomach's secretory function, please always do so under a doctor's supervision. There's a saying, the school bell exists for the teacher. I would rephrase it and say that medicines in the pharmacy exist for doctors, and a person should only buy them if they have truly been prescribed by a doctor as part of a treatment plan. And this treatment plan, of course, from the beginning, through any changes that occur, to the end, everything should happen under a doctor's supervision. If your doctor tells you that for your stomach condition you need to follow a diet, eat at set times, and so on, please listen to your doctor and always try to take the path of treating yourself gently, minimizing the use of any medications, and try to manage everything as gently as possible with diet, scheduled meals, maintaining a proper work and rest routine, avoiding stressful situations as much as possible, and so on. Why? Because then you might ask, but you're a psychiatrist, why are you telling us about this? The reason is actually very simple. What happens next? If you take these medications that block the stomach's secretory function without proper control, you start to develop vitamin deficiencies in the background. And how do they manifest? They manifest as decreased work capacity. They manifest as loss of appetite, joint pain, rapid fatigue, and tachycardia. Moreover, even if a person is living a normal life, for example, just walking down the street at a regular pace, they can already start experiencing tachycardia. and the doctor looks and sees that your heart seems to be fine, there doesn't really seem to be any reason for fatigue. After all, you're just treating your stomach, right? And what does he tell you? He tells you it's psychological. Go see a psychologist, go see a psychiatrist. But in reality, what I just listed are the early signs of scurvy. Do you understand? No psychologist or psychiatrist anywhere on planet Earth or in this universe will ever solve the problem of vitamin deficiency that is developing, and the first signs of vitamin deficiencies, like scurvy, are exactly what I just listed for you. One of the signs of pellagra is tearfulness or even periodic bouts of aggression, and there can also be hallucinatory symptoms. And everyone looks and thinks the person has gone crazy, so they send them to a psychiatrist who prescribes all these antidepressants, neuroleptics, and so on. But in fact, nothing works. Why? Because the cause is different. You need to look for the root of the problem. So here is the root of the problem. If you have a stomach disease, and if it happens that you are constantly taking medications that block the stomach's secretory function, then this chain, this path, leads to very unpleasant consequences. Therefore, please do not take these medications continuously. Please, I urge you to always listen carefully to your medical doctors, who insist on the importance of a proper and balanced diet, and who insist that you strictly follow a healthy work and rest schedule. You must simply listen to them, because the doctor provides this advice not to be difficult or demanding, but because they truly know that you cannot just turn off a vital organ from the whole system, or from the entire complex industry of human digestion, without facing very serious and long-term health consequences. It is absolutely essential to respect how your body functions as a complete unit. And I want to say right away that if you have gastrointestinal diseases, then of course you need to monitor what you eat, as I already mentioned. If you refuse meat, eggs, liver, and everything else, well, this will also lead to very unpleasant consequences for you. I think this video was clear. I think this video was useful. And I would also like to urge my fellow therapists not to forget that when you prescribe these medications to someone, you should emphasize that their use must be limited, reasonable, and applied only in truly necessary cases. This was Sofya Dorinskaya with you. All the best. Goodbye.